This is what a glass of raw milk can contain. Not sometimes, not rarely, routinely, across farms of every size and management style. What's actually in that glass? Raw milk. Episode 2. What's actually in that glass? The pathogens in raw milk don't get there because a farm is dirty. They get there because of basic cattle biology. Dairy cattle carry dangerous bacteria in their gastrointestinal tracts. Bacteria that are harmless to the cow but potentially deadly in humans. No amount of careful milking can fully prevent some fecal material from contacting milk. It's a biological reality of the production environment. Pathogen 1. Escherichia coli O157H7. This strain of E. coli lives silently in cattle intestines. The cow shows no illness. But in humans, it causes severe bloody diarrhea, and in roughly 5 to 10% of cases, particularly in young children, it triggers hemolytic uremic syndrome. HUS causes the kidneys to fail, red blood cells to rupture, and platelet counts to drop to dangerous levels. Children who survive can be left with permanent kidney damage. Some don't survive. Protecting our most vulnerable is why understanding this pathogen is critical. Pathogen 2. Salmonella. Multiple species, Salmonella typhimurium, S. Dublin, S. Heidelberg, have all been linked to raw milk outbreaks. Salmonella Dublin is particularly dangerous because it's invasive. It doesn't stay in the gut. It enters the bloodstream, causing septicemia. It has a high mortality rate in the elderly and immunocompromised. A 1985 California outbreak infected 142 people. That outbreak hospitalized 47 people and killed at least one. It was linked to a state-certified raw milk dairy. The risk of bacteremia makes Salmonella a top-tier public health concern. Pathogen 3. Campylobacter jejuni. Studies find this organism in 50 to 70% of dairy herds. It is extraordinarily common. In humans, it causes the most common bacterial diarrheal illness in the United States. But the tail risk is what makes it particularly alarming. Roughly 1 in 1,000 Campylobacter infections triggers Guillain-Barré syndrome, an autoimmune disorder where the body attacks its own nerves. Guillain-Barré can cause ascending paralysis, respiratory failure, and long-term disability. This can lead to a lifetime of neurological challenges. Pathogen 4. Listeria monocytogenes. Listeria has a property that makes it uniquely dangerous. It grows at refrigeration temperatures. Keeping raw milk cold doesn't stop it. In pregnant women, it causes miscarriage, stillbirth, premature delivery, and neonatal meningitis. The case fatality rate for invasive listeriosis is 20 to 30%, among the highest of any foodborne pathogen. For the most vulnerable, the consequences are often fatal. Pathogen 5. Brucella. Before cattle vaccination programs, brucellosis was a major occupational disease of farmers and veterinarians. Brucellosis causes relapsing fevers, profuse sweating, severe joint pain, and profound fatigue that can last months or years. It can invade the heart and nervous system. Without prompt antibiotic treatment, it becomes a debilitating chronic disease. Undulant fever can sideline a patient for years. And then there's the newest threat. In March 2024, something unprecedented happened. Highly pathogenic avian influenza was confirmed in U.S. dairy herds. The virus was found at exceptionally high concentrations in raw milk from infected cows. Dairy farm workers were infected. Public health authorities issued urgent warnings. Lab studies confirmed that pasteurization effectively inactivated the virus, but raw milk from affected herds remained infectious. H5N1 has historically caused severe respiratory disease in humans with a case fatality rate approaching 60% in some studies. The implications of H5N1 in the raw milk supply are still being fully understood. 6 pathogens, all of them traceable to the normal biology of dairy cattle, not to negligent farming. All of them potentially serious, some of them potentially fatal. And none of them, not one, is neutralized by clean barns, happy cows, or good intentions. In our next episode, we'll look at the real outbreak record. Visit unbedsidemanners.com for more stories. Join us next time for Episode 3, Outbreaks.